Pinky, request everybody to please mute themselves. And also, can you pin Dr. Nangia and myself?
Divya, can you please just check? I don't think everyone's muted. So if you can just check that. If you can mute all.
Yes, Doctor.
Yeah. Okay. So we are live on Facebook now. Thank you everyone for joining us for yet another session of Need of the Hour. We have with us today Dr. Vivek Nangia. Moderating the session will be Bhavna, Vedhara, Chairwoman CII IWN Delhi. I would request all of you to please keep your mics on mute and your cameras off. Over to you, Bhavna.
Very much. I think we can start recording here as well because I know we're live on Facebook, but the yeah, I know, because she speaks right in the middle when I'm introducing. Thank you so much. Okay, a warm welcome to you, Dr. Nangia. Good evening. Thank you so much for being with us.
Thank you.
Welcome to everybody joining us this evening for CII IWN's Need of the Hour. Today we have with us Dr. Vivek Nangia, Principal Director and Head Pulmonology, Max Healthcare. Dr. Nangia, it is indeed a privilege and a pleasure to have you with us today. Thank you so much for coming on CII IWN.
Thank you, Bhavna. Thank you for those kind words of introduction.
Doc, you are, I have to say this because I'm actually in awe. You have been, I mean, right at the front of that front line, you know. You really have been such a light in this storm. So first, I have to really honor you and appreciate that. Thank you so much for all that you do for us.
Thank you.
And Doc, now I know this is about recovery and, you know, post-COVID. How do we really get past it? But Doc, I have to, it would be, it would not be right for me if I didn't touch upon one of the burning questions that everybody seems to have, because you're the light here. So what is, for people who are managing COVID at home, what is the right, is there even a right protocol? And I know it's evolved, but is there a right protocol for people who have, say, mild symptoms versus moderate symptoms? Because there's just so much debate. What's your school of thought on that?
So, you know, at the outset, I would want to state that the treatment for COVID is still evolving. We still don't have that magic bullet with us, which, you know, we can confidently use and say that, okay, we've hit the COVID bug. No, we still don't. Despite about a year and a half into the disease, we still looking for the right answers. We're still looking for the right treatment modalities. Whatever we have so far are very, very, very experimental. And some of it is anecdotal also. In India, especially, there are molecules which are available without proper research. And we're tending to use them only because I think it's a desperate measure, you know, in a desperate situation.
Right.
That whatever, as long as you're not harming the individual, that is a principle that we're believing in as of now.
Yeah.
So now, as far as treatment is concerned, or whatever options we have available to us today, in India especially, you know, the first thing is to classify the patient into mild, moderate, and severe category. When you talk of a mild category, this basically means somebody with simple cold, cough, body aches, fever, but then there's no breathlessness. Oxygen levels are well above 94-95%. When they perform a 6 minutes walk test, the oxygen levels are still maintained above 95%. And they have no significant comorbidity that could, you know, precipitate the severe illness at any time. So only this would be considered a mild category. And such a patient just needs to be at home, probably just taking a paracetamol, along with whatever symptoms he has or she has, symptomatic treatment. Like if you have a cold, probably take some nasal drops, take some cough syrup, keep yourself comfortable, as you would do for any other cold and cough. But keep a very close watch on any signs and symptoms that could indicate that the patient is deteriorating into a moderate kind of a disease. Yet in the mild category, for the high-risk patients, we have the options of using drugs like ivermectin, drugs like favipiravir, which is an antiviral drug, which is analogous to the remdesivir. Of course, we don't have much studies to support its use. But then again, whatever studies we have from Southeast Asia, they have shown that there is benefit of using this drug. So one could use that.
Yeah.
Then there is studies related to usage of budesonide inhaler,
Yes,
which is an
absolutely,
inhaled
Doc.
corticosteroid, which has also shown some benefit in preventing the progression of disease. So when people use this inhaler, there was less likelihood of their progressing into a moderate to severe disease.
So it
But that is
arrested
all.
it, basically. It arrested it even if it didn't.
It would not arrest the disease process, it would just arrest the progression of the disease.
The progression,
But
right?
that too in a very small number of patients, considering that there are 2.5 crore patients, sorry, I think about 1.5 crore patients in India itself. If we are talking about 180 patients, look at the number that we're talking about.
Yeah.
If in 180 patients, you found 60 patients to be benefiting and 60 not benefiting, does it give us much data? It doesn't. Similarly, look at the global number. This is a number I'm talking about from India only. Global number
Yeah.
of the number of patients. But we still don't have any hardcore data to suggest that this drug is like the wonder drug for us, the magic bullet for us. These are
Yeah.
all the options that we have for a mild category. And then the recent one is this Regeneron, that
Yeah.
antibody complex, again for the mild category. Within the first week, if given, has been shown to have some benefit.
Okay, wonderful, Doc. And Doc, let's just for 1 minute just debate the steroids, oral versus inhaler steroids. I know you touched upon it right now, but where would you stand on that in the moderate?
So oral corticosteroids are to be used only in moderate cases. In fact, my recommendation would be that anybody entering the moderate phase of the disease should ideally get hospitalized and get treated properly. See,
Okay.
what happens is that if you reach the hospital in time,
Yeah.
then the treatment also starts in time, and then the recovery is much faster as compared to if you keep delaying it at home. I
Right.
know there was a scarcity of beds and there was a huge issue
Yeah.
of even being able to make to the hospital. But I think if you plan it in advance, like if you know that disease is progressing, you're closely monitoring yourself at home, you're in
Yeah.
touch with your physician regularly who can actually tell you when to reach the hospital. That
Yeah.
is also very important for somebody to be able to tell you when to go to the hospital.
Yeah.
This time, what actually happened was that people kept delaying it, thinking that, oh, it's just a drop in oxygen level, we have oxygen concentrator. So, how many times I've told the people that don't worry about the beds. If you try hard, I'm sure you'll be able to manage it. And
Right.
people did manage it also. But just presuming that the beds are not available, they would just keep sitting at home, keep continuing with the oxygen inhalers, oxygen concentrators at home. Well, some of them did improve, but some of them did deteriorate and could not be salvaged also. So what is important is that the moment the oxygen levels start to drop below 94%, that
Yeah.
is when you have to consider yourself for hospitalization, and that is when you would want to be started on steroids.
Got it.
Otherwise, if somebody starts running fever in the second week of the disease,
Right.
then also there may be a small window to use a short course of steroids to bring the inflammatory phase under control. The
Right.
first week of the disease is considered to be the viral phase. That
Yeah.
is when the antivirals are expected to act, like the
Yeah.
favipiravir or that antibody complex that we have available to us.
Right.
And second week is more of an inflammatory phase, where it is the anti-inflammatory steroids which are likely to act. So in the second week, if somebody develops a sudden onset high-grade fever, you
Yeah.
get a CT scan done, it's showing patches in both the lungs, then you may want to consider giving a short course of steroids to these patients, lasting 3 to 5 days. But if somebody
Okay.
is dropping the oxygen levels below 94%, then you may want to give an extended course of steroids and control the inflammation and control the deterioration in the patient. But
Right.
that would certainly be an indication to be in the hospital and not be at home.
Absolutely. And that would also be accompanied with an antibiotic cover, right? I would imagine.
And remdesivir, of course.
Right. Okay. Thank you so much, Doc. That was great. Okay, now we're going to actually touch upon the post COVID phase, which is, Doc. So acute phase of COVID we know lasts say 2 to 3 weeks, right? But when you go into post COVID phase, people seem to be having what is called long COVID, right? And it's the symptoms are continuing: breathlessness, body ache, fatigue, whatever. So, Doc, what is actually happening here?
Right. So, first 2 weeks up till 3 weeks is considered to be an acute phase of COVID, and then patients are considered to be in the long COVID. There are studies which have been conducted worldwide and have shown that 65% of the people could continue to have some symptom or the other till almost 12 to 16 weeks, even from the first day of symptom. So the symptoms of long COVID could go on till 3 to 4 weeks or even longer at times. The most common symptom that people experience are symptoms that people experience are body aches, fatigue, slowing, mental fogging, brain fog as
Yeah.
we call it, memory lapses, joint pains. There could be some degree of breathlessness and progressive fibrosis. But progressive fibrosis is seen as only in a very small percentage of cases. But long COVID symptoms could overall be seen in nearly 65 to 70% of the people who've recovered from COVID.
That's a huge number, Doc.
Huge number, absolutely. And we are
Yeah.
seeing it these days. So many people after recovery are coming back to us with fever, with rising CRPs, with body aches, with joint pains. So it's happening.
This residual inflammation is just carrying on and just causing.
Okay. Yeah. So this is all because of a residual smoldering kind of a low grade inflammation inside the body, which
Right.
is, which is just persisting for a long period of time. Some people tend to treat it with steroids. Others think that just anti-inflammatory drugs like endomethacin or naproxen could just work. So I would prefer to give endomethacin or something and control the symptoms and watch it for some time and see. If there is any involvement of the lungs, if there's any involvement of the kidneys, then one might consider using steroids. Otherwise, or an antibiotic, antifungal. So, in that situation, you would also need to rule out that there's no secondary infection.
Yeah.
Secondary infection could be bacterial, could be
Absolutely.
fungal, could be tubercular. So all those things would need to be ruled out. But
Yeah.
first 5 to 7 days, control the fever with paracetamol and see, control the body aches with paracetamol, pain relief, and see how things go.
Okay, Doc, you also just touched upon, this strain of COVID seems to be impacting not just the lungs, but it's also impacting GI, liver, kidneys. I want to ask you, is that due to, is that COVID as a manifestation, or is that due to the treatment and perhaps as a consequence of steroids? Is that the implication that they're impacting the liver and kidneys, or is it, and we all know steroids impact diabetics, but is it also doing this here, or what's the relationship?
No, so it's very simple actually. COVID does result in a multi-organ inflammatory syndrome, the MIS, which was earlier common in children, but now we are seeing that in adults also. MISA is what it is called, multi-organ inflammatory syndrome in adults secondary to COVID, which includes all the extra pulmonary symptoms. That means extra pulmonary means the non-respiratory symptoms, which could include heart attacks, could include heart failures, could include arrhythmias,
Right.
embolism in the lungs, intestinal, nausea, vomiting, diarrhea, pancreatitis, strokes, encephalitis, meningitis, you name it, and every organ can possibly be involved with COVID.
Wow.
MISA, multi-organ inflammatory syndrome in adults A.
Right. So, Doc, what do we actually do about this? Is there anything we can do, or are we just helping? Can I request Divya to mute everybody, because there is another sound that we keep hearing, Doc and I are hearing. Yeah.
Well, the treatment would remain the same as COVID, plus the supportive treatment. Whichever organ is failing or getting affected, you would need supportive treatment for that particular organ. Whether it's heart, kidneys, liver. Liver is very commonly being involved. SGOT-PT being elevated is very commonly seen,
Right.
which is like jaundice happening. So they're common involvements.
Right. But this is almost, are you saying that this is a consequence almost of COVID?
Absolutely. It's a manifestation of COVID.
It's a manifestation. Okay. Doc, I have a quick question regarding lungs. And is there a susceptibility, a higher susceptibility to develop like ILD or COPD post recovering from COVID? Or is there a certain type of person who may develop it? Well, that might be a better question.
Right. So there are two different entities. One is COPD and one is post-COVID fibrosis. So before I go on to answer your question, I'd like to explain what fibrosis actually is.
Excellent.
So what happens is that there's initially an infection in the lungs. This infection or an inflammation in the lungs, which results in patches. I'm sure you would have all heard of people having the CT severity scoring. starting
Yes,
from
Doc.
1 till 25 out of 25 score, or 1 till 40 with a total score being 40. So these are all patches in the lungs which are inflammatory in nature. We treat some resolve on their own as a process of natural healing. It's like some people who have an injury on the skin, their skin would heal without any scar behind. Whereas if I was to get an injury, there would be a huge scar left behind. So it's
Okay.
just the same way that if in the lungs, there's an
Mhm.
injury in terms of the inflammation and the pneumonia, some people would resolve on their own without leaving a scar behind. Whereas some may leave the scar behind inside the lungs, resulting in what is called fibrosis.
Okay.
Fibrosis is basically the normal functioning lung has been converted into dead tissue, which is no longer functional now. So there is
Okay.
no gas exchange happening at that level. Carbon dioxide levels and the oxygen levels are not being exchanged in those portions of the lungs, which have now become dead. As a result, people find it difficult to breathe. Their
Mm.
breathlessness sets in. They may require oxygen on a long-term basis. This is called post-COVID fibrosis. This usually
Okay.
starts happening third or fourth week into the illness in somebody with pneumonia. The risk factors for somebody to develop post-COVID fibrosis are an elderly patient, more than 65 years of age, somebody who's been into the ICU requiring very high flows of oxygen, somebody who's been on the ventilator, again requiring high flows of oxygen, smokers, and alcoholics.
I
So those
see.
are the people who are known to develop post-COVID fibrosis. The percentage of patients is very small, and usually we have seen that this is one type of fibrosis which tends to resolve on its own also to some extent with time,
Okay.
and it may not require any particular treatment.
Okay. Wonderful. And then you were going to talk about ILD or
COPD. COPD.
COPD.
So this was
Yeah.
about the ILD is the same as fibrosis.
Fibrosis. Sorry, I
And
meant.
of course, people who have an underlying lung disease would definitely be more prone to developing ILD also. ILD and post-COVID fibrosis is the same thing basically. Then COPD is something new. This is only this time around that we're seeing people are developing an obstructive airway disease.
Yeah.
So not that one will have to watch them in times to come, whether they go on to develop COPD or is it all reversible? We don't know yet. But definitely this time people are coming back to me after 2 weeks, 3 weeks after recovery, developing breathlessness, chest congestion, wheezing in the chest. So they're usually responding to the nebulizers and the inhalers. And that is the only option. Now, what percentage? I guess only time will tell. How many of them will come back to normal? Time will tell.
Okay. Great, Doc. Thanks. I'm going to just ask you one quick question before I go to audience questions. Doc, these antibodies that we keep touching upon, I have a quick question for you. So the person who has had COVID and recovered versus somebody who takes a vaccine, who is better protected? And let me start there. And then also I want to ask you that, after somebody's taken 2 jabs and they have no antibodies, what do they do? So, can you just share with us something
Well,
around?
ask me. Ask me what am I doing? I've taken 2 jabs and my antibody levels are still 5. So I don't know what. But anyway, one doesn't need to worry about it at all, because
Right.
antibodies are not the only mechanism through which our defense mechanisms are functioning against the virus. There is the innate immunity and then there is the adaptive immunity. Innate immunity is with the help of macrophages, neutrophils, lymphocytes, all those so many other cells and cytokines. And then after that is the adaptive immunity, which is with the help of immunoglobulins, that is the antibodies that we're testing, plus
Right.
also the memory T cells and the B cells. So there's this entire array of defense mechanisms that are existing in our body, not just antibodies. Plus antibodies only act to a certain extent. Rest is all the immune response which is functioning. And please remember, it's the dysregulated immune response that is resulting in complications. So when the immune response goes into a disarray completely, that is when the complications happen. It is not because of the virus per se.
Awesome, Doc. Okay, actually, Megha we're going straight into audience questions because it is now 5:50. Antibodies post vaccine is 0. Should one go in for another type of vaccine or take a booster shot of the same?
So as I just said, antibody levels are not the only mechanisms of defense against this virus. There are so many other ways. Don't worry. The only thing is that 6 months later, 9 months later, maybe we reach a stage where we have to take a booster, all of us. One doesn't
Right.
know. So I guess till then, stay safe, follow all the COVID etiquettes, including wearing a mask, staying at a distance from people, and keeping your hands clean.
Right. Okay, Doc, from Malika, what are your thoughts about Covishield versus Pfizer?
That's a difficult question to answer. We only have an exposure to Covishield yet. Pfizer is a different platform of vaccine altogether and is not available in our country yet. It has to be taken 2 shots at a gap of 21 days. As far as the antibody levels are concerned, they would probably be similar because the efficacy of both of them is around 70 to 90%. What I believe is that if it has, the only benefit of any vaccine is that it does not completely save you from acquiring the disease, but it definitely saves you from acquiring a severe disease and saves you from death if you were to acquire the disease. So
Right.
any vaccine, whichever vaccine is available, go ahead and take that as of now.
Okay, post getting from Namika, when after getting COVID, how long should one wait till they get vaccinated?
Sorry, the post
How,
recovery.
yeah, post recovery, how long should one wait to get vaccinated?
So the government of India has come out with guidelines saying that post recovery, 3 months is the time gap that you'll need to keep before you take your vaccine shot.
Okay. From Neha, my father-in-law had COVID in September 20, recovered after 2 months post-hospitalization. He now has joint pains in his hands. Is this associated to COVID? That's quite a few months later, right?
Yeah, it's quite a few months later. I think you'll need to get it investigated. Is it developing osteoarthritis or rheumatoid arthritis or something of that sort?
Okay. From Nidhi, I think you might have this already. How can we manage our persisting symptoms post-COVID recovery? How do we actually manage those symptoms?
So the treatment has to be all symptom based only. So if you have fever, take a paracetamol, body aches, paracetamol. If there are cold, cough, then symptomatic treatment, breathlessness, take inhalers and nebulizers. Headache, again, paracetamol should do you good. Memory lapses, probably a B12 supplement should be a good idea. Weakness, chronic fatigue syndrome, B12, vitamin E, look up your hemoglobin, iron supplements may be needed, vitamin D supplements may be needed. So we'll have to rely on all these therapies to support ourselves during this long COVID syndrome.
Awesome, Doc. So it's symptomatic. From Anushka, hi, Doc. My first HRCT score on the 7th day was 8 on 25. But however, after the infection was over, around the 21st day, my score was 12 on 25. I was again put on steroids by my GP for 10 more days. Then I just tapered it off and have done nothing. My oxygen levels have been fine. This was cured in about 4 days with a bit of, my oxygen levels have been fine. I can't see that. This was reinfected in mid-April, was cured in about 4 days with a bit of a cough for about 10 days. The second time I just nebulized with Budacort. Should I do something more? I can't see. She's just asking to do something more. Here, Doc, actually, there was a gap in my questions. I'm sorry, I couldn't see this. Then I just tapered it off and have done nothing. My oxygen levels have been fine. This was in October when I was infected for the first time. I again got reinfected mid-April. And this time I've just taken Budacort. So should I do something more? She's asking.
So as long as there is no breathlessness, as long as the oxygen levels are well above 95%, as long as the oxygen levels don't dip when you're performing a 6-minute walk test, then there's nothing else that you need to do. Even if there are scars in the lungs, they may just be permanent or they may just heal on their own in due course of time. There's no specific treatment for it as of now.
Okay. Then we've got the next question from somebody named SP. Should all COVID patients get a CT scan done?
So CT scan, when would you want to do a CT scan? You would want to do a CT scan as a part of the monitoring of the disease. If you're suspecting that patient is developing pneumonia, if you're suspecting fever is not settling, oxygen levels are dropping, if there is a patient who has a COVID negative report and you want to establish the diagnosis, those are the situations where you would want to get a CT scan, not otherwise, not as a routine. If somebody is settled in the illness, has no symptoms, then there is no CT scan required.
Okay. Doc from Rinky, post-COVID, there's pain in the sternum and headaches. What should one do?
Paracetamol and some antacids.
Okay. From Jitendra, post-COVID diabetes, how long will it take to get normal? Also feel breathlessness at times. Is that normal as well?
So breathlessness would need to be evaluated, whether it is progressing towards an obstructive airway disease or an interstitial lung disease. And diabetes, I guess time will tell. This is basically a problem with the burning out of the islet cells because the virus sometimes attacks the pancreatic cells. So how much time it will take for it to recover, it will depend on that. If it is only because of steroids, the steroid use which has led to diabetes, then it should settle down soon.
Okay. From Deepika, I have pain on my eyebrows. Is that a post-COVID symptom?
This could, pain on the eyebrows could also be a part of mucormycosis, the black fungus that we are hearing so much about. So I think it would be important to get a CT scan of the sinuses done, of this area done, to see if there's anything there. Otherwise, try and treat yourself for sinusitis and get your eyes evaluated for any eye strain.
Okay. Doc from SP, my daughter, who is 42 years old, suffers from DVT. Can she go ahead and have the vaccine? Please advise if either of the two vaccines available is not desirable in her case.
So since there is some doubt that Covishield may be resulting in clot formation and DVTs and pulmonary embolisms, I would suggest that in a situation like this, Covaxin may just be a better option to go in for.
Okay. Doc, how long, as in how many times a day is nebulization recommended to be done post-COVID?
This is all symptom-based, how many symptoms you have, but nebulization is dependent on the dosage of the drug also that is being given. So there's no standard recommendation that anybody has to be nebulized twice a day or 3 times a day or 10 times a day, but it will depend on the symptoms, the wheezing in the chest, and which drug or molecule is being used. But if you're asking about nebulization or the inhaled corticosteroid budesonide during the acute COVID, then that is to be given as 800 mics twice a day for 10 days.
Okay. From Divya, in case we are traveling and have an option of giving Pfizer to our kids under 13, would you recommend it?
I am not sure of this truly. I'll have to see whether Pfizer can be taken for children as well. As of now, what studies have been conducted, I have not really apprised myself of Pfizer vaccine truly.
Okay. Again, from Mandeep, I still have cough symptoms and fatigue post recovering 15 days of COVID, was on steroids. CRP was 160. Not sure what the question is. Okay, she still has cough symptoms. Anything we can suggest?
So symptomatic treatment only, cough suppressants, nasal decongestants, bronchodilators, they would work.
All right, from Vikash, how long does a vaccine give us protection for, and do we need to take COVID vaccines every year?
So we haven't reached that stage where I can answer that question, but we would presume that the efficacy of the vaccine would be there for at least 3 to 6 months, if not more.
Okay, from Rinky, my Mill had COVID a month ago. She still has low-grade fever and headaches that feel like vertigo. What should we do? Again, it's symptomatic relief.
Absolutely, unless the headaches and the vertigo are too debilitating, then you may want to consider a neurologist, consult a neurologist for it.
Okay, from Namita, any information on when Pfizer or Moderna will come to India, and will it be okay to take an mRNA vaccine post-Covishield or Covaxin?
So if one is, see, basically you have to take only one of the various vaccines available because they all work on a different platform. Their composition is very different from each other. So the vaccines cannot be interchanged. Vaccines cannot be substituted or replaced. If you're taking Covishield, then you have to complete the course of Covishield only. Next year, probably after a gap of 1 year, you may consider, or we'll see how the studies evolve over a period of time, whether there is an advantage of taking one vaccine after the other one or not. As of now, we don't have any recommendation for it. There are vaccines like even in the pneumococcal vaccine, the one against pneumococcus bacteria. There are 2 different vaccines which are used back to back also at 8 weeks gap, at 1 year's gap. So maybe the strategy for this also may evolve over a period of time. but not
Yeah.
as of now.
Okay. From Vishal, I had symptoms last month on the 22nd of April. I was under home isolation. On the 6th, I tested again and confirmed negative. Everything was pretty fine. However, on just a minute, on the 21st, I got, I can't read. Okay. However, everything was pretty fine. However, on the 21st, I got cough. However, no other symptoms. I got my CRP done. Initial result was 31. On second test, it was 22. I am under medication for cough instructed by my doctor. Do I have to worry about anything going ahead?
If it is only cough, then there's nothing to worry about, except that if it starts to be accompanied by fever and all, you just have to keep in mind that secondary infections are common and lung fibrosis are common. So as long as your doctor is keeping a watch for all those things, then you don't need to worry about it.
Okay, from Tulika, if pro-BNP rises post-COVID, what investigation should a heart failure get done? I'm not, I can't understand the question.
So NT-proBNP rises only when there is a heart failure or a fluid overload kind of a situation. So you would need to use diuretics in this situation. Echo would be required and the opinion of a cardiologist would be needed.
Okay. From Rinki, how long does long haul COVID affect the infectious period of the virus? Does it increase?
How does long haul COVID affect the infectious period? The infectious period of the virus remains the same, 10 to 14 days, and not longer than that. It's the body's own immune system which decides whether you will develop a long haul COVID or you will not. As I said, it's a low grade smoldering inflammation in the body, which results in long haul COVID. And the virus has died long time back. The symptoms could still be persisting for days to come.
Okay, from Sarika, Covaxin versus Covishield for 18 plus. There are obviously mixed views. Do you have a suggestion on either?
So Covaxin in the younger lot and Covishield in the elder lot.
Okay, that's great. That's wonderful, Doc. Thank you. We have from Dr. Glossy, I have a post-COVID cough. It's dry and annoying. What can we help her with here?
Cough syrups, nasal decongestants, throat soothers, those would probably help. And steam inhalation. And also that, summers have set in, I would like to put in a word of caution here that avoid using your air conditioners on full blast. They should never be chillier than, say, 24 degrees. The draft of the AC should not come onto your face directly. The fan should never be full speed on. It should only be at number 1 and not faster than that. And avoid having anything chilled, cold, frozen. These could also be resulting in the cough, which we are labeling it as a post-COVID cough.
Very true. Okay, from somebody we can't recognize their name. My relative 2 weeks ago, post-recovery from COVID, has got fever ranging from 100 to 101. I think you've already touched upon that. CRP, though, is high, 160. What would you suggest?
Yeah, CRP is very high. So I guess you would need to consult a doctor and be in regular touch. Maybe some more investigations are needed. You may want to rule out a secondary infection, bacterial, fungal, tubercular, or just an inflammatory process. CT scan of the chest also may just be in order to see if there's any other involvement. Check your liver, kidney functions as well. Maybe there's a COVID, lingering COVID infection there somewhere that is resulting in a high CRP and fever.
Awesome, Doc. Thank you. From Shibani, she's asking, America has gone mask-free after their 2 shots. And here we are double masking even after our 2 shots, and still people are getting hospitalized and dying. So how are you going to make her feel at ease?
Shivani, I know, has not moved out of the house at all in the last 1 year, probably. She's totally confined.
Correct.
So America has gone mask-free probably because they are more civilized than us. They are a lesser population. They are not like overcrowding like we are at every place. And they maintain better hygienic standards than us. So I guess those are the reasons that they're doing better than us. But then there was a time when they were also running for beds. There also deaths were happening in the corridors. People were dying because of lack of oxygen. They've overcome all that. So have we. Ours was a relatively shorter period, I would say, just 2 or 4 weeks, and we're out of it. So we've done a wonderful job as far as controlling the this wave of pandemic is concerned.
So, Doc, since you just talked about that, can we just touch upon the third wave? Are we prepared?
Well, I'm not really an epidemiologist, but yes, mentally we are prepared now for the third wave as well, if that was to happen.
All right. From Tanvi. Hello, Dr. Vivek. Post-COVID, what are the set of remedial measures one needs to take to strengthen the lungs and the immunity? Do you recommend breathing exercises or certain yoga exercises? Is there a rehabilitation program you recommend for those recovered from COVID?
Right. So this would be divided into two sets of patients. One are those who are still continuing to have oxygen when they are discharged, who are still continuing to have residual symptoms and probably progressing towards lung fibrosis. They are the ones who require a proper rehabilitation program where breathing exercises, physiotherapy, lungs, limbs, arms, legs, everything needs to be carried out. They need to be helped to be mobilized out of bed as well. And then there's the other set of people who are who have recovered fully, completely, not requiring any oxygen. They have no breathlessness. Oxygen levels are well maintained, about 95%. For them, I would suggest that they do their regular breathing exercises, not overdo them. Lungs with COVID infection and inflammation become very friable inside. They tend to leak, rupture, like you have these, the tire tubes, the tube getting punctured. Similarly, lungs also get punctured very easily in the post-COVID times. So do not overdo any kind of an exercise. Even otherwise, because of the smoldering inflammation in the body, which could be impacting the heart as well, not causing any symptoms.
Right.
But there could be a low-grade smoldering inflammation in the heart as well. So vigorous exercises, strenuous physical activity are to be avoided completely in the post-COVID period for at least 2 to 3 months. You could go for walks, but gradually build it up to brisk walk, but not that you start jogging right from day one or start gymming right from day one. You have to introduce all these things very, very gradually and build it up as a program over a period of time and not instantly.
And I think just honor your body, right, Doc? Do it gradually.
Absolutely.
Yeah, just honor the body. Okay, we've got from Rama. I am a cancer survivor, 65 years old today, with a diabetic history of 15 years, recovered heart attack, and recently barely survived COVID. My legs still go to jelly and heart strains when that happens. How do we see this? Is this worrisome or is it curable or ...
So I think now that you've recovered from COVID, I would like to congratulate you for that you're out of COVID completely now. So very good. Despite all your medical background, you've really done well for yourself. So now that you're out of it, you're completely out of it. Take that into your mind. Now on, it's only improvement and recovery that you will be seeing, and there's no turning back from that. Yes, as far as legs feeling weak is concerned, heart getting strained is concerned, some bit of it would be psychological stress also, what is called a post-traumatic stress disorder.
Yeah.
But legs feeling weak could also be a genuine problem, for which probably vitamin B supplements, B12 supplements especially, vitamin E, and regular physiotherapy, as I just said. You're one of those who would actually benefit from a rehab program. So you should take advantage of that. And vaccination, yes, of course, you should go in for vaccination.
Yeah, she
3
asked
months
that.
after recovery.
Okay.
3 months after recovery, you should be going for vaccination.
Right. Okay. From Radhika. Doc, please advise the usage of Perfenix to treat ILD and for how long? My 85-year-old father tested positive on April 14th, and his latest scan shows that ILD has set in.
Right. So once ILD has set in already, then we have two medicines available to us to treat your problem, Perfenix and nintedanib.
Right.
Perfenix is a tablet which is known to, so both these medicines only slow down the progression of fibrosis. They do not reverse the fibrosis. They do not prevent fibrosis from occurring. They slow down the process of fibrosis. That means the fibrous tissue formation would be slowed down with the medication. We have seen good results with the use of both these medicines. Pirfenidone, the only problem is that it has a high pill burden. You have to be taking 800 mg 3 times a day, which is the 800 mg tablet is not easily available. So it's either 200 mg to be taken as 4 tablets 3 times a day, or 400 mg 2 tablets 3 times a day. Nintedanib is a simpler option. It is only 100 mg twice a day for the first 2 weeks, built up to 150 mg twice a day for the remaining period. Both the medicines have the common side effects of causing liver dysfunction in terms of jaundice. Pirfenidone could also cause skin rashes,
Right.
and nintedanib could cause diarrhea and loose motion. So you just need to keep a mind for them. If somebody is on anticoagulants like the blood
Yeah.
thinners, then nintedanib cannot be given, but pirfenidone can be used.
Okay. Wonderful, Doc. Thank you for that. That was great. From Harish, I think you've already answered this. Do we have to repeat the vaccination every year? I think we've touched upon that. From Nidhi, although the government has released a suggested timeline recently for post-COVID vaccines, is it okay if we are given our first jab post 6 weeks of recovery in a mild case, although steroids were administered?
Yeah, absolutely. Initially, we always thought 6 weeks is the time frame. WHO also recommends 6 weeks as the time frame after recovery for taking the vaccination, irrespective whether you've taken steroids or not. But yes, you should not be taking, even if you're taking actively steroids, even while you're taking the vaccination. It's just that the immune response may be slightly weaker as compared to if you were not taking steroids. But not that taking steroids is a contraindication to taking the vaccine. Somebody could still take the vaccine even if they are on steroids.
Okay, thanks, Doc. From Shivani, seeing the ground reality so far, do you feel Covaxin is offering better protection than Covishield? That's the first part. And also, Doc, do you feel a pneumonia vaccine is a must after the age of 60? And would it offer any protection from this virus as well?
Right, a very interesting question. So, first of all, Covaxin versus Covishield, I would not be the right person to answer because unfortunately, we don't have any head-to-head comparison or a data available to us that, so many people took Covaxin and this was the result, and so many people took Covishield, this was the result, and there was a crossover. So, this is a very difficult question to answer. As far as the pneumonia vaccine is concerned, so let me correct here that it is not a pneumonia vaccine, it's a pneumococcal vaccine.
Right.
It's a vaccine against the pneumococcal bacteria, which is one of the many bacteria that can cause pneumonia. Pneumococcus is the most common bacteria. 40 to 50% of the cases of 40 to 50% of the pneumonia cases are because of this pneumococcal bacteria. But pneumococcus also causes many other diseases like meningitis, sinusitis, otitis, arthritis, renal problems, bacteremia. So when you're taking a pneumococcal vaccination, you are not protecting yourself only against a pneumococcal pneumonia, but also against a wide range of pneumococcal diseases.
Okay.
And only pneumococcal and not any other pneumonia due to any other bacteria. That is one. Anybody above 65 years of age should be taking the pneumococcal vaccination, which includes 2 shots, one of Pneumovax 23, followed 1 year later by PCV 13. People less than 65 years of age, from 19 to 65 years of age, with a
Doc, the sound is gone. Sorry, say that again, Doc. 19 to?
19 to 65 years of age group
Right.
with comorbidity like diabetes, hypertension, smokers, alcoholics, heart disease, they could be taking one pneumococcal vaccine, the PPV-23. Then those
Right.
who are immunocompromised, like HIV patients, those on chemotherapies, those on a kidney failure,
Yeah.
on transplant patients, those on cancer therapies, they are all immunocompromised lot. They should be taking one PCV-13 vaccine and 8 weeks later followed by a PPV-23 vaccine. So this pneumococcal vaccine is a very complex uh, recommendations for it. And yeah, what we need to remember is it's a misnomer to call it the pneumococcal vaccine, the pneumonia vaccine. It's actually the pneumococcal vaccine.
Awesome, Doc. From Radhika, if the kids are going to university overseas and they take the first jab of Covishield, but don't have the time to take a second jab, can they take a second shot of Pfizer or Moderna?
Well, as of now, the recommendations don't say that, although we'll have to figure out that is there really a harm in taking a second shot. But yes, as of now, we don't have any recommendation for crossing over the vaccine or changing from one vaccine to the other because they're based on two different platforms. So the immune response may just go haywire completely if we do that.
Right. Okay, great, Doc. Thanks. Um, from Ramesh. Hi, doc. It's my 26th day of COVID. Have pressure and slight pain in the chest. O2 level is 98, but a lot of weakness. CT scan done on the 9th day. The score was 6 on 25. Do I have anything to worry about, doc?
As long as your oxygen levels are well maintained, ninth day CT was only 6 by 25. You did not need to take the oxygen during even your acute COVID period. There's nothing to worry about. Recovery is 100%.
Okay, awesome. From Neha, how to protect the kids from the third wave?
The standard precautions of wearing a mask at all times. Children above 6 years of age should be wearing masks, even if they were to go to schools when the schools open. Schools will have to follow certain guidelines and precautions on how social distancing has to be maintained, how cross ventilation has to be maintained in the schools, how teaching can be a blend of this distant learning and uh, uh, classroom learning both together. So
Yeah,
there will have to be worked out, but of course, social distancing, mask, keeping the hands clean, overall hygiene is what will help the children also protect themselves from the third wave.
great. Doc, from Mandeep, how long should one continue to take zinc and vitamin C post-COVID? Also, how many times a day is it advisable?
Well, nobody has the exact answer for this. These are all anecdotal therapies, zinc,
Yeah,
vitamin C, vitamin D. Whether they really work or not, I don't know. Whether we use it only to add on to the prescription, I really don't know myself. But yes, they don't do any harm, is what we believe in. Vitamin C, in any case, is considered to be a good antioxidant. So, 1,000 milligrams per day. And if you're going through an acute phase, 1,000 milligrams twice a day, you could use it. Vitamin C also has certain virucidal properties. That means it does help in enhancing your immune response against the viruses and the bacteria. So, it may be of help. Similarly, zinc, similarly, D. We don't have any concrete evidence to say use it for 2 months, 3 months, 6 months, nor
right.
am I a very strong believer of them. But yes, one does use them when you're against the wall.
Okay. Doc, from Rashmi, she and her husband both had COVID and they used steroids for 3 weeks with the tapering off, obviously. They've got post-recovery, mild COVID infection, CT score of 6 on 25. She wants to know that should she monitor with blood tests? Should she monitor herself with blood tests?
See, basically following the blood test and then one of the blood tests coming abnormal and then switching on and another cascade of tests is basically like looking for a needle in a stack of hay, what I believe in. I think just stay put. You've recovered. Thank your stars. You're doing well. Emphasize more on building up your stamina, building up your immune system, rather than testing yourself repeatedly for something that may not have any consequence in the long run. I always believe if there's a disease which has to come up, it would come up with some symptoms. So let's focus on those symptoms rather than looking at those tests. Even if somebody comes to me with a CRP of say 100, what will I do if he doesn't have any symptoms? Will I treat it or will I just observe it?
So you'll do clinical correlation, basically.
Exactly. So what you
Yeah.
need is a clinical correlation. Even if there is a slightest, I am saying do not ignore that. There are
Absolutely.
slightest symptoms, don't ignore that. But if there are no symptoms, then why unnecessarily test yourself?
Sure, Doc.
But
From
there are people
Shivani.
who want to test for CBC, LFT, KFT, CRP, D-dimer, ferritin. These are the 6 standard tests. If at all you still want to get yourself tested, get these 6 tests done as and when.
Right. Okay, great. So yeah, for your peace of mind, Rashmi, if you really want to, then that's what you do. From Shivani, do you believe steam inhalation helps as a preventative? Also, do you recommend it during COVID? Does it actually help the situation or does it aggravate it?
So if you were to ask me, I would say it does nothing. It only gives you a psychological satisfaction that you've taken something. I know of a lot of people who said, "Oh, I've developed COVID, but I've been gargling all this while. I've been taking steam 3 times a day. I've been bathing every time I came back from outside." Well, how does that help? You have to understand steam is hot air. Hot air rises. So when you're taking steam, all the hot air is probably going into your sinuses somewhere here and definitely not going into the lungs. If at all steam was to help at a temperature where it could be able to kill the viruses, where it could be virucidal, at that
Right.
level, the temperature would be so high that it would probably burn your entire respiratory tract.
You couldn't tolerate it, yeah.
You wouldn't tolerate it. So it's the same thing with gargling also. You gargle only once or twice in a day, 3 times in a day, 4 times in a day, but your mouth is open rest of the entire day. So temporarily the viruses may go down a little, even if I was to presume that they are going down. And again, you're not gargling with hot boiling water, which would be sufficient to kill the virus. So these kind of things are good to do for your own psychological satisfaction, but I don't think medically they have any role to play or help in either preventing or controlling or treating the disease.
All right, Doc. Thank you. From Tanvi, thank you, Doc, for all your answers. You're very articulate. From your experience, when we open up and the lockdown, is lifted, do you think we are going to fare better because of the vaccines and a buildup of herd immunity? What do you feel?
Well, yeah, certainly that I would not expect that immediately as the lockdown opens, we would be back into the COVID wave again. It would certainly take some time if we don't follow the standard guidelines and the standard precautions. Because why I'm saying that is that one, of course, this time, lot many people have got affected with COVID. Practically most of the families in my neighborhood, in my family, in my extended
Right.
family, somebody or the other was down with COVID in this wave. So you're absolutely right. With the vaccination and with the herd immunity, we would expect some improvement in the situation. Not that immediately patient would start coming back all over again. And also that because of the fear right now, many people have lost their loved
Yeah.
one. They've lost a family member. Many families have been devastated. So I'm sure there would be some fear in times to come. So, keeping all that in mind, I would still want to warn all of you that please do not let your guards down. Please continue to wear the masks. Now there are fancy customized masks also available, which you can make use of. And we've got these masks for my team. I'd like to show you here. This is the
Sure.
logo of our team, so we've got them all made for the team here. So
Very nice.
masks, hand hygiene, and maintaining social distance is very, very important for probably this entire year or times to come.
All right. Thanks, Doc. From PHK, hi, Doc. 3 weeks into COVID, I'm recovering, but I do get 99.2 fever in the last 3 days. No fever when I wake or when I sleep. All the tests are absolutely fine, in range. Are there any additional tests required beyond what we just discussed, or is there anything to worry about?
3 days of fever, nothing to worry about, just stay put. Lots of patients are developing this flow grade fever in the post COVID recovery phase. I
Yeah.
am watching and observing them and see how they go. As of now, just stay put and keep a close watch on any other symptom that may arise. If that happens, then you may need some further investigations. Otherwise, let's hold on.
Okay. Doc from Deepika. Hi, Doc. It's been a month since I've recovered. Had COVID, was on steroids for 19 days. Am I still prone to get a fungus infection? The only symptom I have is on the pain on the brow sometimes, and my steroid strength was 4 mg twice a day.
Okay. See, basically, although we are attributing it to steroids, and what I'm saying may just be very controversial and will not be liked by many people, especially amongst the clinicians, but I would still go ahead and say that steroids is not the only reason why people are developing mucormycosis or the black fungus or the aspergillus infection.
Right.
We have been using steroids left, right, and center for years together. We've had patients who've been taking steroids for their sarcoidosis, for their rheumatoid arthritis, for SLE, for various other autoimmune disorders for years
Right.
together. For asthma, I mean, I've seen patients who've been on steroids for asthma, if nothing else.
Yeah,
They have
absolutely.
mucormycosis or aspergillus. Why only now? There is something else that we still don't know about this disease. Either it is just the COVID illness which is acting as a risk factor for developing, it is devastating your immune response in some way. The particular immune mechanism which was supposed to fight this mucormycosis and aspergillus, that has got defected somewhere, which is resulting in such high number of cases. Otherwise, steroids alone cannot be the answer. Also, mucormycosis, the black fungus, is known to occur more in people who have underlying diabetes, especially uncontrolled diabetes,
Yeah.
ketosis, when people go into diabetic ketoacidosis, or they have an underlying neutropenia, that means low total leukocyte count, low TLC or low neutrophils, secondary to a bone marrow transplant or a hematological malignancy like a leukemia, lymphoma, those kind of people are known to develop mucormycosis. Why is it happening now only in COVID patients? We've had patients who've just taken steroid for 19 days, 10 days,
Right.
yet landed up with mucormycosis. So I don't think steroid is the only reason. There are so many other factors. Probably the exact factor, we still don't know what it is, why it is happening. Research in times to come will tell us. And then again, why is it happening only in India and nowhere else?
Yeah,
Steroids
that's
are being
another
used
one.
everywhere.
Yeah.
You know, there are studies of steroids being used up till 500 milligrams per day in patients. So
Wow.
what about them? Why are they not reporting as many mucor cases? There's something wrong somewhere which we don't really know exactly as of now. Just give yourself time, nothing to panic. If you have symptoms, it's always best to detect it early and get it treated early. So if you do have pain in the frontal area around the brows, no harm getting a CT scan done and being safe, whether it is there or not.
Doc, since we're touching upon this right now, there is just so much with black fungus, white fungus, yellow fungus. Doc, can you just give us a one line on these? I mean, it's
So
just,
first of all, black fungus is also white fungus. There's this mucormycosis is not a black fungus, it's a white fungus only. It's a misnomer to be calling it a black fungus.
right.
What it does is it's an angioinvasive fungus. That means it basically invades into the blood vessels of the sinuses of the lungs and causes infarction there. Infarction means dead tissue. That dead tissue is black in color. So because that comes out, people mistake that for a black fungus. I
Yeah.
just did a bronchoscopy for somebody yesterday. Bronchoscopy is like an endoscopy of the lungs.
Yeah.
So, and in the main airways, in this right main airway, we found white fungus lying inside, and that's turned out to be mucor. So, it's mucormycosis is also a white fungus.
Fabulous, Doc. Really not fabulous, but fabulous in the way you answer everything. From Mandeep, post-COVID, my body temperature continues to remain low, 96.5 to 97.5. Is there for the last 10 days? Is there anything to worry about?
So, I think you would be the luckier one. People are complaining of temperature rising to 99 degrees and 100 degrees, and you have a lower temperature. I guess you're the luckiest of the lot. You had a very good recovery from COVID, it seems. But jokes apart, I don't think there's any relevance of this truly. And I think you should stop measuring your temperature now.
Okay. From Radhika, Doc, another question pertaining, she's the one who asked about her father-in-law, for ILD. My father scan on May 19th after 35 days of turning positive suggests ILD changes. My father is using a concentrator 14 to 16 hours a day, has been advised Perkinix 3 times a day. Typically, what should be the duration of this medicine? Just one sec, Doc. Yeah.
I've got it here.
Yeah. Oh, you've got it. Okay. Typically, what should be the duration of this medicine? His blood markers, everything are still high, but we are told that that's not a concern. Please advise.
So, so basically, what I understand is that it's a post-COVID fibrosis that we're dealing with here. Maybe there was an underlying ILD also, because in just 35 days, somebody does not develop frank features of fibrosis there. But anyway, he is requiring oxygen as well. So Perfinex, the dosage of Perfinex is 3 times a day. The dosage needs to be stepped up. 200 milligram for the first week, then 400 milligram second week, 600 third week, and then 800 mg 3 times a day. All these dosages, and that is the maximum dose that you would want to achieve with these patients. Keep monitoring liver functions from time to time. Keep monitoring for any skin reactions. Avoid letting him go out in the sun. There can be skin reactions because of that. CRP, ferritin are still high, will need to be seen in the clinical context, how high they are. If they are really very high, then maybe we still have time or window to use some steroids to bring it down. Please remember, the mainstay treatment for interstitial lung disease or fibrosis is steroids and nothing else. Steroids work as long as it's an active inflammation going on. As I just explained, it's the inflammation which is converting into dead tissue, which is called fibrosis or the interstitial lung disease. So from inflammation to ILD, there's a period of transition. During this period is the time when you use steroids to suppress the inflammation and prevent fibrosis from happening. If the CRP and ferritin are still high, that means there's still an ongoing inflammation. That means he may just benefit from steroids. Of course, we understand the side effects of steroids also. But at the same time, we have to save him from a progressive lung disease as well. So you have to strike a balance somewhere, weigh the risks and the benefits, and then decide the right course of treatment.
Great, Doc. Thanks. From PH, my husband was admitted in the hospital for 10 days. His platelets count after 20 days of discharge is about 135,000. Anything to worry or anything to be done?
135,000 is a fair count. There's no issue. Nothing needed for that.
Okay.
But
Doc,
I'm taking B12 supplements. They may just help build this up further. And avoid any blood thinners.
Okay, great. From Sonali, hi Doc, in America, they say that after 10 days of testing positive, one can go back to normal life. You don't need to retest. Is that correct? There's no requirement for a negative retest.
So before we started this program, remember, we were discussing what questions do we ask, and I was telling Sonali that many people ask me this question, do you want me to answer this? And she said, no, Doc, we've crossed that stage. We haven't.
I said, Doc, we've already done that. Nobody needs to retest.
So this question is still a very pertinent question, which people are not very clear about. So Sonali, I absolutely agree with you. It's not just in America, in Europe, everywhere.
Yeah.
I don't even understand why are we wasting our money on retesting ourselves. You know, there are two sets of people who keep retesting. One are those who have mild symptoms and they don't want to believe the first report, which is positive. So they keep testing themselves to prove that they're actually negative, but the report was falsely positive. So that is one set of people who keep retesting themselves. Second are those who retest because they want to be sure that they are negative. But if you remember, I have discussed this with you earlier also, that there is no point in retesting. Once you are positive, then you consider yourself positive for the next 10 to 12 days.
Yeah.
The likelihood of spreading infection after the 10th day, even if you're COVID positive, are very low, and least after 21 days. There are studies which have shown that people keep testing positive, keep testing negative. This cycle of positive negative goes on till about 12 weeks also, but the effectivity is not there. The infectiousness is not there. Anybody who's positive after say 2 weeks is unlikely to spread the disease to anybody else. So people with mild illness and moderate illness do not need to retest themselves. You could probably donate that money to some charity fund where it could be probably used rather than donating it to the labs that wherever you're getting your tests done from. It holds no meaning whatsoever.
No, please don't retest. Please don't.
Yeah. And even the recent guidelines from Delhi government or government of India say that if you are 10 days into the illness and 3 days without any symptoms of fever, not requiring oxygen, you're free to come out of your isolation. Break your isolation and come out. If you still want to be safe because you have elders in the house, you have people who are suffering from some kind of immune deficiency disorders, take another 3-4 days or maintain a distance from them at all times, wear a mask, stay away. So it's not so difficult really.
Yeah.
But no need to retest.
No need to retest. And I think, Doc, what you just touched upon is that the contagion period, like the time that you are really contagious, 2 days before your, start manifesting.
2 days before the onset of symptoms, till about 10 days after the onset of symptoms.
Exactly. Okay, Doc, from Ritika. Dr. Nangia, I've just recovered from COVID. During my HRCT scan, it was discovered, there was a cyst discovered in my right lung. Is that something to worry about? I still get headaches on and off.
Cyst in my right lung. Cyst. Now you'll have to see what kind of cyst is it. Cysts could be benign, insignificant. They could be causing some, is it a cyst? Is it a bulla? So this is a very vague kind of a term that we're using here. But again, the bottom line is if you're without oxygen, you're not breathless, you're not running any fever, no cough, no phlegm, do not worry about it. Headaches, probably you could, take some paracetamol and see if you're able to break that cycle. If you're prone to migraines, get your migraine treated. Look for the cause of headache if it is persistent. Otherwise, don't worry about it.
Okay. Doc, I know we have really gone over time. Tell me, are you still available to take another 3-4 questions or we can stop?
Another 5 minutes till 6:45. Now that we've come this far, another 5 minutes.
Doc, oh my God, I'm so
That's the question I would love to take. RT, PCR, CT score. You know, when I'm writing a prescription to my COVID patients,
yeah.
the overall interview with the patient, writing a prescription takes about 10 minutes. And then 5 minutes is spent on explaining that the CT score on the RT-PCR has no value,
No meaning.
no meaning whatsoever. And I don't even know why it is mentioned in all the reports. I've discussed with our microbiologist colleagues also that why do you give this value when it
Yeah.
carries no significance? But their standard answer is that these are all guidelines from ICMR to give it. So they follow it. So let me explain what this CTS value is.
Yes,
The
please, Doc.
This is a value which is different from the CT severity score that we get on the CT scan. And
Interesting.
every large CT of the chest gives you a CT severity score that is called CTSS. This
Right.
is called CTSI, cycle threshold. In fact, CT, it's just called the cycle threshold value. So basically what happens is that this is the sample that is taken is subjected to multiple cycles
Mhm.
till the time the virus that has been is okay. Let me redraft it again. So basically, what is it? This is called an RT-PCR test. RT-PCR is polymerase chain reaction, where the sample that is taken carries some minute particles of the virus in it. This is then replicated, multiplied. This multiplication is carried over 40 cycles.
Yeah, 45.
You know, it's made to replicate 40 times to see whether they are able to identify the presence of the virus or not. If until 40 cycles they're unable to identify any living virus in it, they would label it as non-COVID, as COVID negative. Anywhere from 0 to 40, if they are able to identify the presence of the virus, they would label it as COVID positive, RT-PCR positive, right? Now, if it is 10, CT cycle threshold value 10, that means that in the 10th cycle itself, they were able to identify the virus. That means the viral load is high. If they are able to identify it in the 30th cycle, that would mean the viral load was low.
No.
But then viral load high or viral load low does not correlate with the clinical manifestations or the disease or its infectiousness,
Yeah.
its contagiousness. It would basically depend on cycle threshold value would depend on a lot of factors: how the sample has been collected, where the sample has been collected from, whether it was transported properly or not, whether it was processed properly or not, whether there are any lab errors that could have happened. So there are lots of these factors that are involved when you're determining the CT value. CT value is good to know only from the point of view whether it is the viral load is high or low, and that's more from theoretical point of view.
Right.
Clinical context, it has no relevance whatsoever. People, even with a cycle threshold of 25, 30 could be lined up in complications, whereas people with a cycle threshold of 10, 12 could still be going without any major symptoms.
Awesome, Doc. Doc, we skipped Sushmita's. We have heard of people on 15 liters of oxygen in hospitals. All possible medicines have been given to them. Doc, what is the prognosis? How long do they continue like this?
Right. So, this is again a very individualized kind of a problem. There are people with 15 liters of oxygen where if you just stay put patiently with them, they do recover. We've seen several such patients who've recovered fully and gone back home. Maybe not walking, but yes, with assistance. What we need to understand is that as far as treatment modalities are concerned, as I have been repeatedly explaining, that it is the viral phase in the first week, second week is the inflammatory phase, third week is the prolonged inflammatory phase. Till then, the medicines can be manipulated, like steroids, the anti-inflammatory drugs, the tocilizumabs, the baricitinibs, all these drugs can be added. But beyond a time, like beyond the third week and the fourth week, then medicines don't play as much of a role because it's more of a burnt out disease by then. It's the internal healing that has to take place. And every individual has a different way of healing.
Yeah,
People on 15 liters may further continue to deteriorate despite the same set of medication. I've been telling this to so many of my patients. So there was a time when we had about 150 odd patients under me on one particular day.
Wow.
So there were these members who were asking me, doctor, why is my patient not improving? So I told them, see, we are giving almost the same set of medicines, maybe a little tweaked here and there,
Yeah.
to all our patients. 130 of them will go back home, I know. 20 patients, 10, 15 of them will land up in the ICU. 5 of them would still go back home maybe after 2 weeks. But out of these 10, 15 who would land up in the ICU, 2 or 3 may not make it. But we are giving the same set of medicines to all of them.
Yeah.
Ultimately, your own immune response, which will decide who will survive this cytokine storm syndrome and who will not. So coming back to the same question, that if you're on 15 liters, now it's your own internal healing that will determine whether you will improve or whether you will not. Despite this, in this stage, there are 3 or 4 complications that we still need to watch out for. People suddenly can develop clots, despite showing a very good recovery. They could suddenly develop clots, which are called pulmonary embolism. They could develop a pneumothorax, which is like a leak into the lung, like a puncture, which I discussed earlier also. They could develop a cardiac event, like a heart attack, because of strain on the heart, because of the persistently high flow rates. They could go into lung fibrosis and not turn around ever. And and a secondary infection. They could anytime develop a bacterial infection or a fungal infection and then succumb to it. So again, it's the own internal, I would say, destiny and your own healing response that will decide how you fare at this stage.
Excellent, Doc. Thank you so much. Doc, we have one more from Tanvi. After that, I'm going to ask you a question before I let you go. Hello, Dr. Vivek. Is it true that vaccinations will give rise to more mutations? Do you think there'll be more mutations of this disease as a consequence of vaccines?
There's no scientific basis behind it at all. When we are giving the vaccination, we are only giving either a totally killed virus or only a part of the genetic makeup of the virus, which is being used to develop the antibodies. The idea here is not to introduce the virus into the body. The idea is to introduce a particle from the viral genetics to result in an immune response, to enhance the immune response, so that what was happening in the first wave, we always said that we are naive, we are virgin to this virus, we have no exposure, we have no antibodies. With the vaccination, we are trying to create antibodies so that when you are exposed, you already have preformed antibodies inside your body to be able to fight this virus and contain it to possibly a local disease or a mild disease. Again, it's your own immune system which will decide what kind of a disease you have, even despite the vaccination. But we're not resulting in any mutations. Rest assured on that front.
Awesome, Doc. Doc, I know I told you one more question, but I have somebody's private message me something and they're quite concerned. If you don't mind, can we take it? Siddharth is asking, Doc, if someone has been put on the ventilator because their lungs are not working, would the patient recover? And how long will it take the patient to recover? I think maybe there's a lot more here that we need.
Yeah. So, again, it depends on a lot of factors. When has the patient been ventilated, early or late? If it is already in the fibrotic phase, then the chances are poor. If it is early, then the chances are higher that they would recover. Again, whether we are able to protect the patient from a ventilator-induced lung injury also. So there are lots of factors that interplay in this kind of a situation. It's a very complex situation, very difficult to predict. Yes, people have come out of ventilator also. That is something that I would like to state and reiterate, that people do come out of ventilator also. But it depends on a lot of good intensive care practices, prevention of a secondary infection, prevention of pneumothorax, lung protective strategies, and your own healing power and destiny.
Okay. Guys, I request everybody to please stop private messaging me. This is the last, literally, the last question I'm asking, Doc, from the audience. Doc, what about the DRDO medicine? Will that work on a patient who has been on 15 liters of oxygen for 2 weeks or more?
Well, if it is 2 weeks or more, it's unlikely to work, but I think there's no harm in trying it out. It's a harmless kind of a medicine. It hasn't got many side effects. So one could try it out and see.
All right. Now, Doc, final question, and that's from all of us at CII IWN. Doc, we are just wondering about you. How are you doing? How has it been for you, for your family? Just, how are you feeling? That's really good.
Well, it has been tough times, of course. There's no doubt in it. We've come a long way from it. I mean, there were times when I was sleeping at probably 3 in the morning, waking up again at 7 in the morning. My appointments would continue till 1 in the night, and then I would reply back to some 150, 200 messages. I do have the guilt of not being able to attend to everybody who approached me, but I guess this is the best I could have done in the given circumstances. I've had the support of all my colleagues in the hospital who have stood by me, who have taken care of all the patients as though they were their own family members. We have given that kind of a care to everybody as much as possible. Again, of course, there would be people who would still be dissatisfied, especially those who've lost their family members with us. I wouldn't say that, we've been like 100% with all, and nobody can be actually in the given circumstance.
Nobody can be. Yeah.
So I think we've tried our best. My family has been very supportive. My daughter, who was unwell herself with COVID, I could only attend to her for practically 2-minute video call during the day. And I still remember she sending me a message that, Dad, it seems you've forgotten that I'm also your patient and I need some attention. But, I had handed her over to my wife who was looking after her. So when I think back, then yes, my eyes do get moist that what have we gone through.
Yeah.
And it wasn't the best phase of our life for sure. It was very strenuous. It wasn't easy to be taking calls of people literally crying on the phone that, Doc, please get us a bed. Please get us into the hospital. Midnight calls coming. People calling up to say, I just got a message last week from somebody who said, I've lost my father, sir, last week. Lost my brother this morning. Now my mother is lined up on the ventilator. Please help. So it has been a very helpless kind of a situation. I know of families which have been totally devastated. So I think there's a lot one has learned from this, how to be humble, grounded, that what life can do actually.
Yeah.
Even the richest of people have lost their lives to this one minuscule, a microscopic organism. And who will be affected, how, nobody knows. So I think it is a time to have some kind of an insight into how we've been leading our lives.
Absolutely.
And above all this has been our Guruji's blessings on me so far, because of which we've been holding our fort strong. So with all the love and all the wishes that have been extended by all my family members, extended family, friends, social friends, also all the patients, I think, which
Yeah.
has been working well with me so far. And I'd like to use this platform and media to thank everybody who's been supporting me all these days, weeks, and months. And I hope to continue to serve as many people as I can and help as many people as I can.
Doc, oh my God, we are indeed grateful to you for coming on this platform, but for your service to society. Very, very grateful to you. You have really been a light for, hundreds and thousands of people, Doc, at this time. So really, God bless you. Thank you so very much for coming on to Need of the Hour, Doc. Thanks a lot. And for the audience who's with us, thank you very much. I know it's been a long session and a very, very worthwhile session, Doc. Really, so much in gratitude. Please do join us tomorrow for Need of the Hour. We have Dr. Vipul Gupta, who is a homeopath. You will be getting a homeopath's perspective on COVID. Thank you so much for joining us today, and a good evening to everyone. Thank you, Dr. Nangia.